So thanks so much for being here today. So as I've been already introduced, I won't spend much time on this slide. And I hope I won't do any cultural appropriation, but I would like, first of all, to acknowledge the country. So we would like to acknowledge the traditional owners, custodians of the land in which we meet today. I would like to pay my respects to the elders, past and present, and I would like to extend my respect to the Aboriginal people, colleagues, staff, and students who are present today. So back to business. Tobacco and alcohol are a global burden. In France, they are the first causes of preventable death, with more than 75,000 deaths a year when it comes to the use of tobacco products in general. And we are talking about more than 41,000 deaths a year when it comes to alcohol use. Worldwide, we are talking at more than 8 million deaths a year because of the use of tobacco products, and more than 3 million deaths a year when it comes to tobacco use, alcohol use. Sorry. But we can see that nowadays, actually, adolescents, teenagers are much more clever than us because they are drinking less and less, they are smoking less and less. And when I'm saying that they are smoking less and less, I'm talking about tobacco, but also cannabis. We can try to explain that because of some legislative efforts that have been put in place, which has led us to see a kind of denormalization of the use of such products, tobacco and alcohol use. Because of the neutral pack of cigarettes, the fact that we can smoke in most of the public spaces nowadays, and in France we have many regulations regarding advertisements of alcohol and tobacco products. So although there is a denormalization of such products, we can still see that the use of these products is still culturally embedded and is still associated to pleasure, conviviality, and freedom. So that's still kind of a problem, almost that we see that new products are emerging. New products that are emerging and new products that are not regulated. So when it comes to tobacco use, to the products of tobacco use, we see that there is all these new electronic devices that are emerging. And there are nowadays more than just electronic devices where you would vape, smoke. Now you can use them as a game with the good old Tetris or Miss Pac-Man or Mr. Pac-Man. You can also associate this product to your social media. You can use them to vape CBD product. Is it correct, CBD? Not Central Business District. We see as well in France that snus products are coming strong. Like that's kind of products that were used to be sold, that are sold in Nordic country, but nowadays we see them coming again really strong in France with very nice flavor and kind of a nice design that are really appealing to young people. When it comes to alcohol, it's the same. We see that there is still a lot of premix products, sugary products that would be associated to alcohol, or the classic one, kind of a rum and coke that would be already mixed. We see that there are loads of beers that are being advertised as well, and that are pretending not to address any message to teenagers, but yet, like, when we are grown-up adults, I'm not sure that we would like to be drinking kind of a little devil beer or whatever. I don't know. We see that there are a lot of beer that are advertised as being 0% alcohol, as alcohol-free. And we see as well that there are loads of water-based products that are sold, water-based products that are mixed with alcohol. So that's something that I didn't know about. So for the research, the science, I had to try it. And I have to say that it's very good. So that's really bad and low in calories. So that's another thing. And so all these products, we see that they are emerging. They are not regulated. And so because of that, we see them a lot on our social networking sites. And so we don't know if they are here, they are advertised, or they are here to entertain us in a kind of way, because are we kind of promoting the product, or are we just posting about our lives, and our lives involves us using the product? So that's kind of a question that it's a bit blurred. So we have to know about it, and we have to kind of warn the most vulnerable people. That would be adolescents in our case. So that's how we have developed the En Réseau project. So to develop a pilot prevention program, which would be embedded in the French school system, which would be led by stakeholders with experience in preventive education, and which would be tailored to the specific needs and context of each school, so that we could equip adolescents with the skills to resist tobacco and alcohol products promotion on the social networking sites. So we started with 3 assumptions. We assume that a media education program can meet teachers' needs regarding the prevalence of social networking sites in adolescents' daily lives, and that would align as well with the French national education curricula. We also assume that combining health prevention and social networking sites education can enhance adolescent skills while integrating the educational health pathway that we would have through the school's years, and which is outlined in the national education program. And we also assume that a preventive program grounded in experiential knowledge and co-construction would be more readily accepted and implemented by stakeholders and the target population. So to do that, we used a 6-phase social marketing approach, and we aim at reaching 2 targets in parallel, the schools and the adolescents. So the first phase, understand your targets, we draw from experiential knowledge and feedbacks that we got from the fields when it comes to schools. So as said, when we look at schools, we've seen that we have the French National Education Ministry that has asked schools to implement an educational health pathway that includes media literacy. We've seen that the schools lack time to create new programs and that the teachers want to be involved, but they have limited time for training. When it comes to adolescents, based on a literature review and focus group that we did with our teenagers, we've seen that adolescents seek a sense of belonging to a community, that they are resistant to manipulation, and they have some understanding of online advertising practice. They are not that stupid. We see that although they have that understanding, they are often unaware of specific online influential strategies. Because again, for them, seeing alcohol or tobacco products online, it's kind of something that is normal. They wouldn't think that it's something that is advertised as we would do for clothes, for example. And so they want to be empowered to make their own choices in life. When it comes to the second phase of the social marketing approach that we used, so again, drawn from experiential knowledge and the feedback that we receive from the field when it comes to schools, we've seen that there are few opportunities available to introduce new programs due to limited school time. We've seen that schools face competing priorities, such as addressing health and societal concerns. Schools and parents are concerned about social networking sites. Some want to educate adolescents about them, while others prefer to avoid or restrict their use. When it comes to adolescents, still based on literature review and from a content analysis that we did on posted that were seen on social networking sites, we see that celebrities often promote unhealthy behaviors, that cultural norms can encourage the use of tobacco and alcohol products, that online legislation concerning these products is still ambiguous, and that the line between promoting tobacco and alcohol products and simply sharing daily life about them can be blurred. For the third phase, segments your population, we've seen when it comes to school that some schools face more issues with alcohol, while, we see that some schools face more issues with alcohol while others struggle more with tobacco, so we have to take that into account. We see that parental restriction can limit the content schools develop. And we see that there are loads of difference that exist actually between private and public schools, as well as schools that are in an urban area or a rural setting. When it comes to adolescents, we see as what happened in schools that some adolescents are more prone to alcohol use, while others are more inclined toward different types of tobacco. And we see that there is also socioeconomic factors at play when it comes to tobacco and alcohol use. So the fourth phase of our social marketing approach when it comes to schools is to implement a prevention program across various types of schools consisting of a multiple station with an evaluation component to really see what we are doing, if it's working or not. And when it comes to adolescents, I'm not synchronized, sorry. And when it comes to adolescents, we want to enhance adolescents' media literacy, specifically their ability to navigate social networking sites content when it comes to tobacco and alcohol use products. Sorry. So the fifth social marketing approach that we use, the value proposition via the social marketing intervention mixed. So we use the 5P, products, partners, price, place, promotion, when it comes to schools and alcohol. So when it comes to the products, we are talking about a prevention program that is addressing schools' concern and that is helping adolescents to develop competencies to enjoy social networking sites responsibly. When it comes to the partners, the program is co-developed with stakeholders already delivering health-related programs in school. When it comes to price, the program is free for schools, except when we are talking about the time. We are asking schools to allow us to have a 3 sessions program and 2 hours of evaluation. And when it comes to adolescents, we are asking them to create a fresco to present to their parents and to complete as well pre- and post-program questionnaires that last 1 hour each. When it comes to the place, the programs are delivered in schools, incorporating adolescents' knowledge and actual social networking sites use and examples. So first of all, we ask adolescents what type of accounts they are following, who are their favorite influencers, so that we can really personalize the programs. And when it comes to the promotion, we promote the program directly to schools and adolescents using simple, engaging tools and information. So that would be the flyers, really basic flyers that we would distribute within the schools to promote the program to the schools. So we make sure that the partners from the field and the partners from the inside, in kind of way, the people working in the regional department for digital education are seen by the schools. We kind of include the keywords that match the official programs from the Ministry of Education. And we give schools few numbers about tobacco and alcohol products and social networking sites used by adolescents. They always love good numbers. And we try to show how we would involve them and set the objectives, plan the intervention with them. So when it comes to the program, as I've said, 3 programs, 3 sessions, which last between 1 hour and a half and 1 hour and 45 minutes. So the 3 sessions were really a minimum that we wanted to implement, because the literature showed that the more sessions you do, the better impact you have. But 3 programs is really the maximum we can ask schools to allow us to work on that. So 3 sessions, 1 working on the advertisement associated to tobacco and alcohol products, 1 session in working on the influence and the influencers, and another one which is working on the social networking sites and the shared responsibility each of us would have regarding the advertisement of tobacco and alcohol products. Each of the sessions are leading to the creation of a fresco by adolescents, so that at the end of the sessions they would try to collect all their ideas, all the lessons that they've learned and that they want to share with their parents or their relatives or anyone. And so that would be the program that we want to deliver at schools. We have developed the kind of brand en réseau, so believe it or not, it's not the new sushi place that you will find next where you live. It has kind of a Japanese design, but it's supposed to be trendy among adolescents in France, at least. So en réseau, réseau is for réseaux sociaux, so social network. And so there is a sense of things that are connected. We are all connected. We are asking the questions if they are influenced or influencer. And there is that balance between the wolf and the sheep. So there is no right or wrong answer. I'll let you decide if there is a good, a bad one or not, if we are one or the other, or if we don't have kind of a balance, actually. So that's kind of the brand that we want to work on. And so when it comes to the results, so for the school, we've seen that there is actually few opportunities, as we said, that are available to introduce new programs due to the limited school time. So that was kind of something positive for us to intervene. We've seen that the school faced competing priorities such as addressing health and societal concern. So that was also something that was positive for us to kind of promote the program. But for the third point, when we are talking about schools and parents who would be concerned about social networking sites, we've seen that we are still struggling to kind of sell the program because some schools would be really under the influence of parents. And so if the parents think that it's really bad, if we don't talk about the problem, it doesn't exist, that would be a problem for us. So just last week, I got actually a few results that were entered by some of my students when it comes to the program. So as I've said, we are asking schools to share 2 questionnaires with the students, one at T0 before we develop the program and one at T1, 1 month after we have completed the program. And if we are lucky enough, we ask the school to fill a 3rd questionnaire. We'll ask the adolescents, to fill a 3rd questionnaire. It would be, it's September, which would be the school year after we would have developed the program. So like that, there would be a kind of a whole summer that would have been, that would have passed, and we know what happened during summertime. We experience a lot of things. And so during the sessions, we also did a kind of a photo language where we, do you say that? Photo language? Yeah. So we share a photo with the teenagers, asking them which photo represents the most for them, alcohol or tobacco. We also asked what were their favorite influencer. So for the photo language, we've seen that 89% of the teenager picked a negative image, 5% a positive one to talk about tobacco, and 6% of the adolescents picked a neutral picture. When it comes to alcohol, on the other hand, we've seen that 71% came up with a negative image, 9% with a positive image, and 20% with a neutral image. So I think that's kind of, yeah, quite accurate with the balance that we have nowadays in our society regarding these 2 products. When it comes to social networking sites, we see that YouTube, TikTok, and Instagram are the most social networking sites used by adolescents in France. When we looked at the accounts that they have shared with us, 35.6% of them are owned by someone who drink alcohol, and 17.8% of these accounts are also owned by someone who smoke. So the program, so it's a pilot program that is implemented in 7 schools. At the moment, we have the data of 398 adolescents who are about 13 years old. And so we see that 87% of them hold an account on at least one social networking site. We see that 21% of them have already used alcohol. Nearly 75% never have used alcohol. And we see that in the next 12 months, so in T0, nearly 42% of the adolescents think that they will probably drink, and even that 12.7% that they would even get drunk. Otherwise, we see that the majority of them don't see themselves drinking within the next 12 months. When it comes to alcohol, we see that 22.6% have already smoked, 72% never. 13.2% will probably smoke in the 12 next months, and most of them as well don't see themselves smoking. So as I've said, we are collecting the answers step by step. So we have 3 schools that have completed the program at the moment. We've seen that between T0 and T1, we have a difference between the answers that we have collected. On T0, we have 204 answers, 196 at T1. And we see that we are facing kind of a matching problem between T0 and T1, because out of these 200 or about 200 answers, there is only 149% that are matching. So we see that we have some discrepancies, like when we ask if they have an account on one social networking site or more. On T0, 137 adolescents would report that they have one, whereas less would report having one in T1. So I don't think that they've dropped one account while we were doing the program, but well. So I don't have much time left, but some of the results that we've seen, and like it's really just to share first results, because again, like we are talking about really few adolescents, and like there is nothing that is really a statistic significant at the moment. So we see that at T0 we had more adolescents that are reported to have smoked, whereas at T1 there is less. We don't know why. We've seen that between T0 and T1, actually, when we asked adolescents how many 14 years old adolescents of your age, well, 14 years old, how many of 14 years old how many 14 years old adolescents smoke? Do you think how many? Try to reunite all the information. We see that actually adolescents would report that 47% of teenagers of 14 years old would smoke, so which is a bit less than what they said in T0. But so although like there is less adolescents who would smoke according to them, we see that they are quite kind of in line with the reality. We've seen that there is actually a report of less adolescents smoking at 17 years old. We see that there is more adolescents reporting that they would smoke in the 12 months, which is not great, but again, we are talking about a difference of 4 adolescents, so here we are, and so on and so on. So again, really short time. When it comes to alcohol, we would see that here actually.
I'm just conscious, Boris,
Yeah.
You've gone over to, have you got like a key slide, a final slide, just so
Yeah.
some burning questions in the room?
So again, like here, it was just to show that although that we had kind of encouraging numbers with the smoking part, when it comes to alcohol, there is still questions that are being raised. That is the fact that actually after our intervention, people would think that people of their age are more likely to smoke. And so just to say that actually when it comes to adolescents and the program that we've tried to develop, we see that we confirm that celebrities can really promote unhealthy behaviors, that the cultural norms can encourage the use of tobacco and alcohol products, that the lines between promoting tobacco and alcohol products is really blurred. Even talking about it with teenagers and looking at them, even us, we don't know if there is a real promotion or not. And looking at the results, we can't help but wonder if there wouldn't be a kind of a reactance problem at play. So that's the reference. That's for me. Thanks a lot.
Thank you so much, Boris. I mean, I work in the public health unit, and just you know, we've made such great inroads in tobacco control, and then we're like, you know, we always used to use this like, oh, look at social marketing, the impact of that in tobacco, and how it will come, and there's like now these new products, and I think just for, you know, for practitioners, researchers, and policy influencers, I think this presentation really challenges us to think critically about how we engage youth in the digital space and how we can extend these insights into other public health concerns in online environments. Does anyone, I'm just very conscious, I want to make sure that each of the speakers equally get 30 minutes to present, but we've got about 6 minutes. Has anyone got any specific question they'd like to ask Boris about his project?
I guess that here the kind of discrepancy things was about like, should we actually educate adolescents regarding social media use, or should we, on the opposite, try to control these social networking sites? That's kind of the question, because I've heard that in Australia you've passed a law where teenagers are not supposed to have an account when they are below 16.
Just a question. How do you think you can easily replicate this in a different cultural setting? So, for example, how specific are these cultural values to French students? Do they hold specific values that then you can't transfer? So if you were to take this program and come to Australia and go, right, we're going to implement this in schools, do you think it's highly what's that word?
Replicable?
That word, yeah. Or is
Just
it
ask me.
Well, or do the values that are upheld by French students are specific to that cohort? Does that make sense?
Yeah, so that's kind of the question, because even in France, we would have kind of really different cultures among the country. And so that's why here kind of the main point was not to develop a program that would be really static in kind of way, but really to work with the stakeholders, because that's something that we found out. They are actually not aware of their knowledge and how they could be impactful. And so during the process, during the development of the program, we were trying to be sure that they would understand that we would rely on their knowledge. Because again, we would have just the base of the program, but then you would have to adapt that program to what's going on at the schools. So again, some schools would report that their students would smoke tobacco products, would smoke vaping products, would smoke cannabis, and others would report that they have problem with alcohol. So you have to be sure that you would be adapt yourself, and again with the rural setting, urban setting. So that's why we are trying to develop a program that actually could have a base for stakeholders to implement something that could be universal kind of way.
I think it points to the importance of like changes at different levels, like policy changes, like access to social media, but also grassroots programs like these, just all on the sort of social marketing spectrum to sort of influence behaviour change. I know I worked in a project with that looked at sugar-sweetened beverages in Polynesian communities in Western Sydney, and the aim from the insights was around they were pissed off that the marketers were marketing to them, and that was their motivation. They didn't care about their risk of type 2 diabetes or losing their teeth. It was just like, I'm going to stand up to big soda and like give them the big bird. And so I think it's sort of understanding like, how
We could empower them against some industrials, big things. Yeah.
So upsetting to see these flavoured, the techniques that they're using to, change behaviour. So, this is kind of healthy because it's strawberry flavoured or something. It's very frustrating. Is there any comment?
I just have a quick question. Why 13-year-olds?
So
And
because
did you look at
that's kind of the threshold in France. That would be at the moments where they are not smoking or drinking, but they would be likely to do it. So we had to find a moment where it was not too early, because when it's too early, it's just like, oh, smoking, it's bad, alcohol is bad. But like during the summertime, there's like drinking booze and smoking, and so we had to be at that moment just before it would arrive. And again, that's something that we would try to adapt depending on the schools. If they told us that, oh well, at that stage they are angels, no worry, we would do it at the 14 years old. And because the 13 years old stage is really the national one, the national numbers that we would see. But yeah.
I'm sure Boris has got we've got afternoon tea after this session, so just we can
Have a drink. Thanks a lot.